Welcome to the fiscal year 2012 Continuum of Care Program Competition Debriefing broadcast for HUD's Office of Special Needs Assistance Programs, also known as SNAPS. My name is Lisa Kaufman. I am a SNAPS desk officer along with my colleagues Ebony Wilson and Matthew Aronson. We will be your presenters today. The purpose of this broadcast is to provide an overview of the FY2012 CoC Program Competition and to give you all a heads up on the FY2013 Grant Inventory Worksheet, GIW, and the CoC registration process. So we will discuss 7 topics today. The first one is the FY2012 CoC Program Competition. The second one is the fiscal year 2012 funding highlights. Third, pro rata need and annual renewal demand. Fourth, the CoC Consolidated application. Fifth, the project application. Sixth, the fiscal year 2013 GIW and CoC registration. And then lastly, we will end with some resources that you all can use. The fiscal year 2012 CoC competition was the first under the CoC program interim rule. The fiscal year 2012 CoC program competition opened November 9, 2012 and closed on January 18, 2013. This was the latest start and end date in recent years. As this was the first year under the CoC program interim rule, we acknowledge that there were challenges that impacted our ability to open and close the competition. These challenges included waiting for our rule to get published, updating e-snaps, etc. HUD announced the Tier 1 renewal projects on March 13, 2013, after the competition closed on January 18, 2013. HUD determined, based on the funds available and the remaining project applications that were submitted by the project deadlines, that there were enough funds to move ahead with funding, with awarding the Tier 2 renewal projects. The tiers were financial thresholds that HUD required to ensure that COCs had the opportunity to prioritize their projects locally in the event that HUD was not able to fund all renewals. So due to the hard work of the field offices and headquarters in closing out projects and recapturing funds, we were pleased that there were enough funds this year to fund both tiers. However, this may not be the case in subsequent years, so it's very important for COCs to prioritize all projects. New projects were awarded August 1st, 2013 for those COCs that scored 97 or higher on their CoC application. New projects that were created through reallocation were not dependent on the CoC minimum score of 97. So this year, there were 8,801 project applications that were submitted into e-snaps, all of which had to be reviewed by HUD staff. Those applications requested more than $1.8 billion. HUD awarded $1.6 billion to 8,066 projects, of which 489 of those were new projects. 3% of the total funding awarded in the fiscal year 2012 competition went towards new projects, whereas 97% of the total funding went towards renewal projects. So a couple of things that we want folks to be mindful of moving forward. The CoC applicant profile must include the name and information of the HMIS lead, and the organization entered as the HMIS lead must match the HMIS applicant as designated in the project applicant profile. So we'll now talk about the UFA designation. Any collaborative applicant requesting UFA designation must have already been performing all of the duties as outlined in 24 CFR 578.11, which included meeting all the requirements as stated in 24 CFR 578.7, which is responsibilities of the continuum of care. This year, 32 collaborative applicants requested UFA designation. The review process for determining UFA status eligibility had 2 parts. First, a cursory review was completed to ensure all questions were answered and complete. And the collaborative applicants that passed the cursory review were then reviewed more in depth based on the requirements listed in 24 CFR 578.7 and 578.11 of the CoC program interim rule. So the review included information provided by the collaborative applicant based on what they are doing, not what they plan to do. Many of the narratives provided were missing key information, such as the written governance charter reviewed and updated annually, the HMIS information and coordination, the code of conduct and recusal process for board members or any person acting on behalf of the board, the coordination with emergency solutions grants, and the fiscal control for the projects. So we're going to present some funding highlights for this year's competition. So these are the scores, the total scores. There were 130 total scores. There were up to 4 bonus points. Each CoC should have received their debriefing summary, which provides for you your scores in each section. The summary was sent to the field office to be forwarded to the collaborative applicant. So any CA that has not received their debriefing summary yet, please contact your field office. As you can see on the pie chart, 51% of the CoCs scored above the funding line. A major issue we saw during the review of the CoC applications is that the information in the narratives did not fully answer the questions that we asked in the application. The information that you all provide in the narratives should comprehensively answer the question that is being asked. We encourage that all training materials and detailed instructions for the application be thoroughly consulted. While CoCs have a great deal of experience completing the application in previous formats, this year there were so many new questions. Questions may and probably will change from year to year, so it is important to fully read all guidance provided to ensure that the CoCs are answering the question as it's being asked on the application. So now I will now turn it over to Matt to continue.
Thank you, Lisa. In fiscal year 2012, HUD awarded 7,577 renewal projects, compared to 7,153 renewal projects in fiscal year 2011. The number of renewal projects increased by 424 from the previous competition. In fiscal year 2012, HUD also awarded 489 new projects. Most of the new projects awarded funding were created through reallocation or were CoC planning costs. Each year, the amount of funds available for new projects decreases as the number of renewal requests increase, making the competition for new funds even more challenging. In fiscal year 2012, HUD awarded $1.6 billion of the available $1.8 billion to CoC program renewal projects. The funding of these renewal projects allows homeless persons to continue to be served and moves forward toward self-sufficiency. Not renewing these projects would likely result in project closure and the displacement of the homeless people being served. All CoCs were able to reallocate in 2012. Funds could be reallocated to create new permanent supportive housing projects, new rapid rehousing projects, or new HMIS projects. And due to the emphasis in CoC program interim rule for a centralized or coordinated assessment system, CoCs were also able to reallocate funds from a supportive services only renewal project to create one supportive services only project specifically for a centralized or coordinated assessment system if one did not already exist in the CoC's geography. Preliminary Pro Rata Need, or PPRN, is designed to estimate the basic funding need of a CoC based on the geography that the CoC has claimed under its jurisdiction. It is the first of several factors that help HUD determine the total amount for which a CoC is eligible to apply and be awarded. The PPRN formula can be found in section 578.17a of the CoC program interim rule. Annual renewal demand, or ARD, is calculated by every CoC during registration and is equal to the sum of the annual renewal amounts, or ARAs, of all eligible renewal projects expiring between January 1, 2013 and December 31, 2013, within the CoC's geographic area and before any adjustments are made based on FMRs. The ARD amount is determined by information submitted on the Grant Inventory Worksheet, or GIW, and it is the second of several factors that help HUD determine the total amount for which a CoC is eligible to apply and be awarded. The methodology for establishing the ARD can be found in section 578.17b2 of the CoC program interim rule. Please see the FY2012 NOFA definition for the method HUD used to determine ARAs. The final pro rata need, or FPRN, is the higher of the PPRN, ARD, or the amount from a possible CoC merger process. This serves as the base for the maximum award amount for the continuum before HUD considers new funding under CoC planning, adjustments to budgets based on a change in FMR, potentially available bonuses, or in the future, when applicable, UFA costs. HUD considers CoCs in PPRN status when the FPRN is equal to the PPRN, and ARD status when the FPRN is equal to the ARD. The CoC merger process is available to merging CoCs, at least one of which was in PPRN status, and at least one of which was in ARD status. The process prevents a loss in FPRN for merging CoCs. CoCs received the total of the FPRN, the final pro rata need, of each original CoC to calculate their fiscal year 2012 FPRN. Again, these calculations were completed during the registration process. When HUD introduced the GIWs in fiscal year 2009, the intent was for CoCs to have a working list of all CoC-funded projects in the CoC's jurisdiction. Each year, HUD has sent the GIWs for review and update to the CoCs and used the final version, as approved by HUD headquarters, as the basis for the CoC's ARD. This was called the HHN, the Hold Harmless Need in past competitions. The need for accuracy was never more important than in fiscal year 2012 CoC Program Competition, because for the first time ever, we faced having to make cuts. Unfortunately, many CoCs did not make sure that the GIW that was submitted during registration was absolutely correct, and therefore had to make adjustments to their final GIW at least once, and in some cases, multiple times, as possible cuts would be based on a CoC's ARD. CoCs must have a full understanding of the CoC-funded projects within their jurisdiction going forward. Going forward, CoCs must closely consult with their field offices and, most importantly, the CoC-funded recipients within the CoC's jurisdiction. If you have not done so already, it is suggested that you review your FY2012 GIW for accuracy and begin the process of verifying all CoC-funded projects, and make note of start and end dates to ensure accuracy of the GIW in future competitions. HUD anticipated that CoCs would prioritize and protect renewals in Tier 1, as Lisa described, but many CoCs took a risk by not placing all renewals in Tier 1. Some CoCs placed a large number of new projects in Tier 1 that bumped lower-ranked renewals into Tier 2. This year, thankfully, we were lucky as we were able to fund more projects than originally anticipated. We may not have this flexibility going forward, and so CoCs need to prioritize the Tier 1 projects. CoCs also need to inform project applicants of where they are ranked in the CoC's application. CoCs also need to inform project applicants of where they are ranked in the CoC's application. And for a detailed description of the tiering process, please review the fiscal year 2012 NOFA, section IC16 and VB1B. And now I'd like to hand over the presentation to my colleague Ebony Wilson, who will discuss the FY2012 CoC Consolidated application.
Thanks, Matt. CoC applicants are expected to read the CoC Program Interim Rule and NOFA thoroughly prior to completing the CoC application for homeless assistance. Many CoC applicants approach this year's application as if it were a continuation of last year's and cut and paste language from previous applications, which in many instances did not fully answer the questions on this year's application. Consequently, this resulted in missed points. It is important for each CoC and each project application to treat each year's application as a new endeavor. While your project or the work of the CoC is continuing, it is important that you fully describe what the CoC and the project application is doing as relates to the questions. HUD provides detailed instructions as part of the eSNAPS application on the left menu bar and training modules via the HUD Homeless Resource Exchange HRE website to CoCs in an effort to provide as much assistance as possible in completing the CoC application. The resources included step-by-step training modules for each section of application. In addition to the guidance and training modules, Applicants also had the ability to contact the virtual help desk on the HRU website with questions. Questions were answered as long as the information requested was not protected under the HUD Reform Act. HUD assumed that the COCs utilized these valuable resources. However, during the review of the consolidated applications, COCs continued to lose credit on questions because the instructions, guidance, and training provided was not followed. It is imperative that COCs ensure their responses fully provide answers to the questions being asked. The CoC application included 4 scoring categories which were defined in the FY2012 NOFA. These included CoC Housing Services and Structure, Homeless Needs and Data Collection, CoC Strategic Planning, CoC Performance, and there was a 5th category, Leverage, which is not in the application. Its points were calculated from the project application data. Please note that there is a difference in the layout of the application and the scoring criteria established in the NOFA. While some questions may have been included in a certain section of the application, their score may have been applied under a different category. We are working to better align the questions and the scoring categories for the next competition. Applications were assessed on a 130-point scale. Section 1 contained 14 points. Section 2 had a maximum of 21 points. Section 3, a maximum of 55 points. Section 4, a maximum of 34 points. And leveraging were worth 6 points. There were also 4 bonus points available. Up to 2 bonus points were for COCs with 100% of their new project applications proposed to serve chronically homeless individuals and families, and up to 2 bonus points were for COCs where 100% of the project applications requested 7% or less in project administration costs. The CoC Housing, Services, and Structure section made up a total of 14 points. The average score for Part 1 was 10.33, indicating that most COCs have established a good CoC structure and are able to accurately provide information on housing stock. The majority of COCs demonstrated the existence of a coordinated and inclusive and outcome-oriented community process, which includes a broad membership of public and private organizations as well as individuals. A significant part of Section 1 were questions about the CoC review and ranking process. In Section 2, Homeless Needs and Data Collection, the average score was 19.93 out of 21. All COCs are expected to have a functioning HMIS. However, COCs need to remember that per the Violence Against Women Act, VAWA, victim service providers are prohibited from entering into HMIS. There is no impact on a CoC score for HMIS as a result. COCs should not require domestic violence projects to enter into HMIS or imply that their projects are less competitive as a result of not being able to enter data into HMIS. VAWA, however, does not prevent domestic violence projects from maintaining a comparable database without personally identifying information and providing the CoC aggregate data for inclusion in the CoC's reporting. HUD required that each CoC conduct a point-in-time count of sheltered and unsheltered persons at least every 2 years during the last 10 days of January. The last count was required in 2011. Even though the unsheltered count is only required every other year, HUD strongly encourages COCs to conduct an annual unsheltered point-in-time count if resources allow, as this significantly increases the quality of data that a CoC can produce. As you know, beginning with this calendar year, 2012, sheltered counts are now required annually. COCs that indicated a count on a date outside of the last 10 days of January 2012 should have requested and received a waiver from HUD. If a CoC conducts an annual sheltered and unsheltered point-in-time count, the counts must occur within the last 10 days of January. Any CoC that conducted a count outside of the January 22nd through January 31st timeframe must have received a waiver from HUD, whether it is an official count year or not. COCs request a waiver by contacting Michael Roanhouse at michael.roanhouse@hud.gov. COCs were asked to describe the methods used to collect and calculate sheltered and unsheltered population data, including information on subpopulations. In some of the questions that asked the CoC to select the methods used and describe each method. Many CoCs did not get full points because while they selected options, they didn't describe all of them. CoCs were expected to use methodologies consistent with HUD point-in-time guidelines. Information on the HUD point-in-time guidelines can be found in the Guide for Counting Unsheltered People and the Guide for Counting Sheltered People. A link to both of these documents were provided in a CoC application detailed instructions and could also be found on the 1CPD website. CoCs were to compare the most recent point-in-time count to the previous one and indicate in the narrative which years they were comparing. The narrative should also have specifically addressed factors that may have resulted in an increase, decrease, or no change in both the sheltered and unsheltered population. A common error in this section was not correctly responding to the question asked. For example, some CoCs neglected to indicate which years were being compared or only addressed one of the counts, sheltered or unsheltered. Maximum points were only awarded if the CoC had a decrease. The CoC strategic planning section of the application looked at the extent to which a CoC demonstrated the existence of and alignment with a performance-based 10-year strategy for ending homelessness that establishes specific action steps to achieve the 7 objectives indicated in the NOFA. The CoC's progress in working with the appropriate local government entity to develop and implement discharge policies and protocols for persons leaving publicly funded institutions or systems of care demonstrate coordination with HPRP, NSP, HUD-VASH, and any additional ARRA programs. Provide information on educational assurances, and finally, demonstrate leveraging of funds requested under the FY2012 CoC NOFA with other resources. In FY2012, the leveraging score was calculated on eligible new project requests only. CoCs were asked to provide 2 narrative responses describing the short-term steps and the long-term plans the CoC would implement in order to achieve the proposed numeric achievement associated with that objective. The narratives were to include 1 or more specific, measurable, achievable, and realistic steps that were directly related to the objective. A proper response included a specific description of what the CoC was going to do, how they were going to accomplish it, and a discussion of who would be responsible for implementing the plans. CoCs were to specify the CoC lead agency, committee, or other agency by name that will be responsible for carrying out the steps. Many CoCs did not follow instructions on how to demonstrate numeric achievements, specific steps toward meeting the numeric goals, or identify the stakeholder by name. The narrative responses also had to be related to the numeric goals. Depending upon the objective, CoCs were to provide either a number of beds, percentage of homeless persons, or number of households. Furthermore, while the first 5 objectives were looking for an increase in numeric achievement, the 6th objective regarding households with children should have demonstrated a decrease. CoCs were required to provide cumulative increases or decreases for each objective from the baseline to the 10-year goal. Specific examples were provided in the detailed instructions. The McKinney-Vento Act requires that state and local governments have policies and protocols in place to ensure that persons being discharged from a publicly funded institution or system of care are not discharged into homelessness. To the maximum extent practical, continuums of care should demonstrate how they are coordinating with and or assisting in state or local discharge planning efforts to ensure that discharged persons are not released directly into the streets, emergency homeless shelters, or other McKinney-Vento homelessness assistance programs. Form 3B, CoC discharge planning, asks CoCs to provide the what, the where, and the who in relation to their discharge planning policies and protocols. CoCs were asked to provide information on the policies and or protocols that the CoC either has in place or is developing for each system of care to ensure that persons are not routinely discharged into homelessness, the streets, emergency homeless shelters, or other homeless assistance housing programs. Many CoCs improved their overall discharge planning narrative scores by providing clear descriptions of the policies and procedures that were either being developed or already in place. However, Many CoCs fail to clearly identify the stakeholders and/or collaborating agencies that ensure persons being discharged from publicly funded institutions are not being discharged into homelessness situations. Response should have addressed the policy, the person, and stakeholder responsible for ensuring the policy is implemented. Many CoCs did not clearly specify what the discharge planning steps were, who the stakeholders were in the planning process, and/or where persons being discharged go upon release from the institutions. The last section of Part 3 was Form 3C, Continuum of Care Coordination. CoCs were to discuss participation in or coordination with at least one of these programs, HPRP, HUD-VASH, and NSP, as well as other HUD-managed ARRA programs. CoCs should have indicated the amount of funding that was awarded to their jurisdictions and clearly described the efforts to coordinate and collaborate with one or more of the programs identified. CoCs that did not have any jurisdictions which were receiving any funding from at least one of these programs should have indicated this in a narrative. Finally, CoCs were to describe how they addressed and worked with homeless veterans and youth populations. With regard to educational assurances, CoCs were to indicate if they already had established policies in place that require homeless assistance providers to ensure all children in homeless assistance programs are enrolled in school and connected to appropriate services within the community. CoCs were then to describe the established policies. They were to describe efforts to collaborate with local education agencies and describe how the CoC will continue to consider the educational needs of children in homeless families. I will now turn it over to Lisa Kaufman.
Thank you, Ebony. So Part 4, the CoC performance, was another section that carried a large proportion of total points. The average score for this section was 19.05 out of 34 points. Section 4 of the application has the largest number of points assigned, as HUD wants CoCs to report on their overall performance as reported by the renewal project applications, as well as the CoC-wide activities to reduce homelessness. The information was to be completed using the data reported in the 2009, 2010, and 2011 point-in-time counts and the housing inventory charts. Additional information requested for this section included funding sources for all new beds created for chronically homeless, created between February 1st, 2010 and January 31st, 2011. CoCs were provided an opportunity to explain increases in the chronic homeless population, if any, and the circumstances that caused the increase, and if there were decreases in the number of permanent housing beds for this population, the reasons for the decrease. Many CoCs had different numbers in their application than what was submitted in the HDX. CoCs were to report on housing performance and enrollment in mainstream programs based on all of the APRs submitted within the CoC, regardless of whether a project submitted a project application in the fiscal year 2012 competition. Successful transitional housing programs had at least 65% of their exiting participants move into permanent housing, and successful permanent housing programs had at least 77% of their participants remaining in the HUD CoC funded program for 6 months or longer. CoCs should monitor the project APRs annually in an effort to assist low-performing projects in meeting or exceeding the overall performance. The enrollment in mainstream programs and employment information chart measured the success of exiting program participants in CoC-funded housing and supportive services programs who obtained the various mainstream resources available in the community, as well as determining the program's success in assisting program participants obtaining employment. The CoC-wide goal is 20% or more of participants exiting these programs with employment income from the CoC-funded projects based on the most current APR submitted to HUD. If a CoC fell below the housing or income performance goals, there was an opportunity to explain the reason or reasons associated with not being able to obtain or maintain one or more of the performance measures. CoCs that did not have projects for one of the types of programs listed, permanent housing, transitional housing, or non-HMIS supportive services, were not penalized. CoCs with projects that did not submit an APR timely were to include the missing APR by calculating 0 for the performance measure. New questions added this year dealing with performance included how the CoC monitors the recipient's performance, how the CoC assists the project applicants in reaching the HUD established performance goals, and how the CoC assists the poor performers to increase their capacity. So Section 5 was leveraging, and the average score was 2.06 out of 6 points. In order to get the full points, 100% of all projects needed to have 150% leveraging amount in order for the CoC to get the full points. And now I will turn it over to Matthew, who will talk about the project application.
Thank you, Lisa. So the project application presented several challenges for our applicants this year. First and foremost, as mentioned earlier, fiscal year 2012 was the first competition under the new CoC program interim rule. As such, even renewal applicants were required to fill out forms in great detail with new fields and little pre-populated information. The FY2012 NOFA also communicated unique program requirements that were new for renewal applicants. There was also the first year that included certain project types, such as CoC planning, coordinated assessment supportive service projects, and rapid rehousing. As such, HUD expected that all project applicants thoroughly read the CoC program interim rule, the general section NOFA, the CoC program NOFA, the project application detailed instructions, and the project application training modules. Over the next several slides, I would like to highlight specific areas of the application that were most challenging for our applicants. They include the following: the SF424 and AAA, which I'll explain in a bit, threshold review, educational assurances, reallocation, budget information, Category 2 at imminent risk of homelessness, Category 3, homeless under other federal statutes, make sure the numbers match, and permanent housing and Samaritan bonus projects. The SF424 is a HUD standard form that is built into our online application in eSnaps. It is required for all applicants. Most importantly, for renewal grants, the SF424 must be completed by the current recipient and must not be completed by a project subrecipient. Unfortunately, this year, several grants came in for HUD review having been completed by the subrecipient, with subrecipient information on the SF424 rather than the current recipient. AAA stands for all project applicants must attach all required documents accurately. The standard HUD attachments that this include can be found in the project applicant profile in eSnaps. There are links to upload the HUD 2880, the Code of Conduct, Drug-Free Workplace, and, if applicable, documentation of nonprofit status. The Survey for Equal Opportunity and Disclosure of Lobbying are also important. And of particular note, the HUD 2880, which for 2012 was required to be up to date for the fiscal year, many applicants submitted old HUD 2880s that required a condition to be placed on the grant award before grant agreement. The new project application requires more detailed information than the renewal project application to allow HUD to determine whether the project meets the new project eligibility requirements. New projects were eligible for a variety of component types and grant terms, each with their own unique set of requirements and restrictions as listed in the fiscal year 2012 NOFA. It is important to note that CoC planning, bonus, and reallocated projects are considered new projects and were reviewed by HUD using the criteria for new projects established in the NOFA. One important difference is that reallocated new projects were not subject to the CoC score threshold, while CoC planning, bonus, and other new projects were subject to the score. HUD further differentiated new project types by creating an order in which they would be conditionally selected. And to learn more about conditional selection, please refer to Section VB1B of the fiscal year 2012 NOFA. Renewal project applications were also expected to meet project eligibility, capacity, timeliness of expenditure, and performance standards identified in the CoC program NOFA. Many projects, unfortunately, came in either with the expectation to serve ineligible populations, insufficient budget information, or one of a number of other deficiencies that may have resulted in a rejection recommendation or required that the project be significantly conditioned before being allowed to go to grant agreement. It is vital for renewal grant applicants to understand that this is both a new grant program and that it is a competitive grant program. Even grants that have received funding for more than a decade must take the applications seriously and make sure that it is completed to the best of their ability and according to the requirements of the CoC Program Interim Rule and the CoC NOFA. For the last several years, the application has included 2 questions regarding educational assurances. It is important to note that this is a statutory requirement written into the McKinney Act, and that even though we have only been asking these questions for a limited amount of time, they have been statutory since the beginning of the program. These questions are applicable for any program that serves persons under 18 years of age. However, programs are responsible for understanding their state and local education laws and for knowing up to what age and under what circumstances those guarantee public education services to persons over 18. If public education in your community is guaranteed until the age of 24, then your program must comply with these 2 educational assurances to ensure that each of your participants receive the same public education services that all persons in the community have access to. This also includes access to early child care provided to children from birth to 5. The reallocation process has existed now for several years and is a way for COCs to shift funds from existing renewal projects to new project applications without decreasing the COC's annual renewal demand. It is vital that the reallocation decisions made at the COC level are discussed and communicated well to the project applicants. In many cases, the reallocated amounts listed on the COC application did not match the amounts that project applicants were applying for. In some cases, projects identified themselves as reallocated projects when in fact they did not appear on the COC application. In other cases, projects did not identify as reallocated projects, even though they were indeed on the CoC application as being reallocated in part or in whole. Communication is key here, as HUD will default to the community decision listed on the CoC application after verifying project eligibility and ARA on the GIW. Please remember that reallocated projects are new projects and are not continuations of any renewal projects. It appears that some COCs erroneously thought that they were simply amending renewal grants or consolidating renewal grants while using the reallocation process. This was a significant error, as the reallocated projects are new projects with new start dates and a new focus. The budget forms comprise of several eligible budget line items that include new construction, acquisition and rehabilitation, leased units, leased structures, rental assistance, supportive services, operating, HMIS, and COC planning costs. The availability of these forms depended on the type of project that was selected by the applicant and which is described in detail in the fiscal year 2012 NOFA. For renewal projects, it was very important that the amount requested on the application was equal to the amount listed on the final GIW. If the amount requested for a budget line item, or if the total units for rental assistance was higher on the application than on the GIW, the project budgets were reduced accordingly. HUD did not raise an award amount if an applicant requested less money than was listed on the fiscal year 2012 GIW. As has been the case for some time, budget shifts between eligible line items of greater than 10% were not allowed on the application. HUD used the GIW to match the previous award with the requested amounts and made the changes as necessary. The 10% is calculated on the line item that is being reduced and not the line item that is being increased. It is also important to note that as a result of the recategorization of some costs, certain shifts were actually allowed without being calculated into the 10%, the most prominent example of which was food moving from operating to supportive services. The participant eligibility requirements for our programs are discussed in great detail in the CoC Program Interim Rule and the fiscal year 2012 NOFA. However, I do want to mention 2 common issues that we observed this year. The first involves Category 2, or persons at imminent risk of homelessness. Permanent housing projects are not permitted to serve persons that fall under Category 2 of the homeless definition. Unfortunately, many projects indicated their intent to serve persons at imminent risk of homelessness on the application. Supportive service only and transitional housing projects may serve Category 2, but they should have provided an explanation to verify that they would adhere to the 14-day eviction requirement. On a related note, persons exiting institutions after more than 90 days no longer fall under the category and therefore are no longer eligible. The second I want to discuss involves Category 3, which allows a project under certain circumstances specified in the CoC Program Interim Rule to serve persons defined as homeless under other federal statutes. To serve Category 3 persons, a CoC first must request and receive permission from HUD. In fiscal year 2012, no CoC was granted permission, and so therefore no projects are permitted to serve this population this year. HUD observed inconsistent numbers in the vast majority of project applications that we received. In some cases, the inconsistencies may have been justified, but in most cases, the numbers just didn't make sense. It is vital that project details such as units, persons served, performance measure universe, HMIS participation, the budgets, and all other forms make sense in context so that HUD can appropriately review and award. Finally, I would like to say a quick word about bonus projects. Applicants were asked to indicate whether the project had originally been awarded under or was applying for the first time under a special housing initiative. Most importantly for renewal projects, the detailed instructions asked applicants to refer to their original grant agreements and determine whether they were awarded as PH or Samaritan bonus projects. These projects were awarded with special requirements and restrictions, and so HUD reviewed all projects based on the self-identification to ensure that projects continued to adhere to those restrictions. Many projects inappropriately self-identified as a bonus project, even though they were not awarded as a special housing initiative. Some of these project applications were adjusted through the HUD award process to account for the bonus rules and regulations and may need to be amended to correct the adjustment. And now, to take us beyond fiscal year 2012, I will turn the presentation over to my colleague Ebony, who will walk us through the fiscal year 2013 GIW and CoC registration.
And finally, we will briefly discuss the fiscal year 2013 Grant Inventory Worksheet and CoC registration. The fiscal year 2013 GIW process has not changed much from fiscal year 2012. SNAP's office sends the GIW to the CoCs and the CPD field offices. The CoC and field office review the GIW and address issues and/or concerns. The CoC registration notice is then published and eSNAPS opens for CoC registration. Then the SNAPS office reviews the final GIW. The majority of the columns and functionalities of the FY2013 GIW were familiar to the FY2012 GIW. However, there are new columns and functionalities that the CoC and project applicants must pay close attention during the GIW reconciliation phase. These new functions will assist in the reconciliation phase with the CoCs, project applicants, and your local CPD field offices. For this year's registration process in eSNAPS, collaborative applicants will not be required to upload the GIW on behalf of the CoC. However, collaborative applicants will still need to enter in the total CoC's annual renewal demand. The CoC is responsible for knowing its inventory, consulting with the project applications and local HUD CPD field office if any questions or issues arise, assuring that all eligible renewal projects are listed, and getting approval from the local field office before sending the GIWs back to SNAPS. The following resources are recommended for you to access to assist in the GIW reconciliation and completing the FY2013 CoC registration. The FY13 GIW facts, the CoC merger document, the CoC merger worksheet, and the CoC registration training modules. Lisa.
Thank you, Ebony. So information from today's webcast will be made available on the 1CPD info website and on HUD's website. It is imperative, if you haven't done so already, to please go to 1CPD and sign up for one or more of the listservs. This is our primary way of communicating with our CoCs and grantees. There are also Ready, Set, Go webinars that are held, and those will provide valuable information there announced via HUD listserv messages. As we move into implementing the CoC program interim rule, these resources will provide valuable information as well as training materials, and you can find those on 1CPD. So this concludes the SNAP CoC Program Competition Debriefing broadcast. On behalf of Matt, Ebony, and myself, as always, we thank you for your commitment to ending homelessness. Have a good day.